there have been some interesting experiments where hospitals are paid for outcomes rather than procedures. That has turned around and much as you two have been at the vanguard of, made them think much more holistically about social determinants of health. What have you observed and what is working for in terms of making those shifts?
The Robert Wood Johnson Foundation has this amazing phrase called your zip code may be more important to your health than your genetic code. And I think that as we
Mm,
look at what predicts to health, Dr. Glasgow talked about it, right? Like healthcare alone is probably 10 or 20%. And then you've got your genetics, maybe 20%. And then you've got 60 to 80% that's social and behavioral related to where you live. And that's including green space to exercise, safety, being able to have access to healthy foods and other things. And so, what I've often said is, I don't know why we in healthcare are not in the zip code improvement business. Like,
Mm.
why don't we think of it that way? And I'll just use one really great example from Cincinnati Children's. They looked at the disparities, the health inequities that were talked about around asthma. And they showed that there were certain neighborhoods that had 4 to 5 times the hospitalization rate than other neighborhoods did. And they applied actually a neighborhood level quality improvement program. This was published in Health Affairs last year, where they showed that by doing a neighborhood level intervention, they reduced the number of bed days by 20%. So if you're being paid a certain amount of money and you've reduced the bed days, that becomes an economic model. It's not a charity model, it's an equity model. And that is something that I think we need to be doing much more in the future.